Thank you so much for the invitation to be here, actually, to everyone at Women's, and of course for Valerie for moderating. It's very exciting to be part of this launch. And as the sort of representative for women's health research, I'm going to start by offering you the words I plan to say at the end, because I don't want to run out of time. And I think it's important to make sure that the messages kind of flow through what I'm going to say about my own career path. So the first thing I want to say, especially for young people out there who are wondering if they're making the right choices, and maybe you have an undergraduate degree and you're not sure if to go back to school. And, you know, it's hard nowadays to make career choices, harder than it was in my era. And yet my path was quite circuitous, and I'm thrilled with what I'm doing now. So number one is trust your gut. I know these are all going to be cliches, but really and truly, if you find something you're passionate about, first consider yourself lucky. See if you can find a way to make a living at it. And if you can't, because who in the world was doing global cancer care 10 years ago when I started out on that path, find something else you're also passionate about or good at or feel confident in, and try to arrange a situation that enables you to do that, make a living, and still do the stuff you're passionate about. It's all possible. You know, I did a medical degree, but I didn't end up with a classical medical career. So the other thing is to practice tuning out naysayers, and I'll get to that in a sec. So how did I start? Well, two parallel interests, beginning with, I think in my family, there was a feeling about social justice from a very young age. And I remember watching the Watergate hearings at the age of 6, 40 years ago. And yeah, why did I watch the Watergate hearings at the age of 6? It's because the news was always on. And apparently I did a mean Nixon impersonation back then, but I digress. I always felt there was something that I needed to do to help other people. And so human rights became a focus. And at that time, by the time I was 12, I was speaking a lot about children's rights, and we need to have respect, and we need to be heard. And a friend of mine's dad was a journalist, and I ended up on some TV show talking about children's rights. Unfortunately, it had consequences. And I learned from having very personalized, specific death threats. Can you imagine? At 12. That sometimes speaking out about things you are passionate and you feel principled and you feel like there's something that is an injustice. You know, at that young age, I was very self-righteous about it. If people are telling you you're wrong or you should be silenced, then you're probably on the right track. You're probably onto something. So there will be detractors, but you have to learn to just tune them out. So I went on to have a career in genetics as a genetic counselor first, knowing that I wanted to do science and I wanted to help people. I ended up luckily working with the great Dr. Stephen Narod, that many of you know. He's the Canada Research Chair in Breast Cancer, senior scientist at Women's College, co-discoverer of BRCA1 and 2. And yes, I'm talking about somebody else's accomplishments because he inspired me to go further. And from there, I decided, you know what? I had a lot of questions in my mind of what to do, and I wanted to go further and ask better questions. And how to do that was to go back to school. So I did medicine, and I became a medical oncologist, cancer chemotherapy doctor. But that still wasn't quite enough. And in the back of my mind, I wondered why in the genetics clinic, most of the people we saw were white and affluent. This was Montreal about 22 years ago. And I kind of parked that idea as I went through medical school and all my training in medical oncology here in Toronto. And as I became an oncologist, again, the equity issue came up. Why are we paying so much attention to these really high-priced drugs, the smart bombs of cancer medicine, right? Molecular targeted agents, they get the headlines, but they help very few people at extremely high cost and will never be available to most of the women with breast cancer and women and men and children with cancer in general in developing countries. So off I went. Fact-finding tour. I took time out of my training. I decided I better get off the academic medicine treadmill before 20 years go by, and that would be an interesting career, but wait a minute, I'm missing something. I'm missing the forest for the trees. I need to take a step back. So I stepped off that treadmill and took 2 months with a backpack and very little money, and I backpacked across Southeast Asia solo. And I went into hospitals, and I talked to people living on the street, and I went into villages, and I asked them what they thought about cancer. Did they know the word cancer? I saw the people at MSF working with HIV patients and realized, oh, geez, they don't need oncologists here. I picked the wrong specialty. So I had a little crisis there, thinking I should have been an infectious disease doctor. What am I doing? I'm gonna go home and join MSF. Yeah, that's what I'll do. But I knew, actually, eventually I'd find my home, and that there was a great need for oncologists in developing countries. I didn't happen to know anyone doing this kind of work, and I literally came home kind of going, okay, I'll do cancer, but I gotta keep looking, and I Googled Vietnam and breast cancer and found a mentor. Incredible. Madison, Wisconsin, the International Breast Cancer Research Foundation, Dr. Richard Love, took me under his wing. I went to Vietnam, started working with the National Cancer Hospital. I'm now an advisor. I've been going there 8 years. We're having a delegation from Vietnam coming to Women's College, Princess Margaret and Sunnybrook, next month. 7 doctors coming from that sort of interaction and long-term trust. So that was a real learning experience for me, that even though I didn't know anybody else doing it, and it seemed like a hard sell. I mean, I would mention cancer in developing countries, and I'd get blank stares, including my own in the mirror. I know there's people out there suffering, but where are they? Where are their voices? And the Millennium Development Goals and the global health community. Cancer wasn't being discussed. It's not on the list. Neither is heart disease, diabetes, hypertension, chronic respiratory diseases. But now they are. So all these years later, there were a few of us here and there doing this kind of work, coming together, part of a global task force now, et cetera. So don't listen to the naysayers, including the one inside you. I knew there was something out there that maybe I could contribute to, and this brings me to the women's health equity piece. So I started working in Bangladesh about 4 years ago. I co-founded a small breast clinic in rural Bangladesh. And when we had women, we had the clinic, and we thought, great, now people will come to see us. Us being the Bangladeshi doctors. We were very hands-off, just a couple of us from North America. And they weren't really coming, dribs and drabs. So we had to find out why this was. You know the expression, if you build it, will they come? And when they don't, why aren't they coming? So we did interviews with women who were coming in with horrible advanced breast cancer, the kind of tumors you don't see here. Maybe once or twice in your career, you'd see what we see every day there, every week. And we asked them, did you know you had a problem? And how long ago did you know you had a problem? And if you knew, why didn't you come? And in the words of my mentor, he says, these women are poor. They're not stupid. In fact, to survive, you have to be very, very smart under those conditions. You can imagine rural Bangladesh, very conservative society, extreme poverty, roads washed out frequently, bad infrastructure, limited health care. And so we asked them, and we decided to embark on a project using mobile phones. And this is the little chapter that I call the reluctant entrepreneur. Who knew I'd end up working with a mobile phone company in Bangladesh, social business enterprise by local Bangladeshi brilliant computer scientists who trained at MIT, went back into the country of their birth to help people, and developed a couple of apps to guide interviews door to door with women, show them a video, a testimonial of women who'd been to our clinic, and that it's okay to talk about your breast. It's okay to come for care. And so that's the project that I had funded by Grand Challenges Canada, and what I'm working on today and for, I think, the next few years is this project. It was as much about women's empowerment as it was about breast cancer. We hired 30 young women with high school education to do the interviews, 3 female, all women, 3 female supervisors, and in 4 months they interviewed 20,000 women in their homes. And now we're submitting this for academic publication because, as Jane pointed out, incredibly important to evaluate what you're doing, share the knowledge, including the failures. So a couple of my last comments are, you can't have success. You can't get to a point where you are leading without having a lot of failures along the way. If you don't have any failures, then you're doing something wrong too, you know? And just to end on a sort of funny note, Sheryl Sandberg's book, Lean In, absolutely love that book. Even when you don't feel you have the confidence, and believe me, I feel that every day, picture yourself as if you do. Sometimes that's all it takes, a little push for yourself, and then you find it later on. And in the meantime, you can do great things. Thank you very much.
Great. Thank you, Ophira. And now another perspective entirely.